Welcome. In this video we're going to be talking about lung health. Now the lungs are such an important part of our body, but we can't see them and it's not always easy to detect if there's something wrong. So therefore it's really important to be proactive when it comes to looking after our lungs to try and reduce our risk of lung disease later on. So I'm joined now by John Burke, who's Bupa's Medical Director, and we're going to be talking all about lung health. And let's start off by discussing some of the risk factors that can increase your risk of poor lung health and potentially the risk of lung disease later on.
Thanks, Zoe. The biggest risk for lung health, I think, is smoking. So, inhaling smoke through tobacco, etc., that really can damage the lungs over time. It all depends on for how long somebody's been smoking and how much they're smoking as well. So over 7 to 9 of all lung cancers are related to smoking, it seems. Secondly, thankfully, we've moved on beyond the era of passive smoking, secondhand smoking in this country due to some changes in the law many years ago. But that was a risk. It still would be a risk for some people who lived in that era. And moving on to other things like chemicals in the workplace, what comes to mind is asbestos. There was a time when that was used quite heavily for insulation in the construction industry, in the motor trade, and motor industry, let's say for brake linings. So some people were exposed to that, and that can lead on to a type of lung cancer called mesothelioma. And then in construction industry again, and even in mining, there's been quite a high risk, and still is in some places, of conditions related to lung problems from silica being in the air, dust particles. So you might have noticed in London and beyond, when there's construction underway, sometimes there's a sprayer out there to put moisture in the air and to bring down that dust. It doesn't go into people's lungs. And finally, I suppose more generally around air pollution, it's great to see the steps are being taken to minimize exposure to engine fumes. And we seem to be pretty much past the era of coal fumes. London used to be well known for.
I think it's important to point out that, even if people are exposed to some of these things, if they have some of these risk factors, it certainly doesn't mean that they inevitably will get lung cancer. It is just one of many potential risks.
That's right. So by definition, risk factors are exactly that. They're just risk factors. So they need to be modified, hopefully, by people. They'll, manage their risk over time, keep healthy, keep health conscious, be lung aware. And something as simple as having a good diet that's high fiber, low in fat, and keeping exercise as part of one's routine can raise the heart rate, increase the air coming into the lungs, and then sort of make for a better, more healthy lifestyle.
That's really interesting. So that's really interesting. So even, having a healthy diet, exercising regularly, all these things will help look after the lungs. What other tips do you have that you can give to people when it comes to helping improve their lung health or certainly maintain it and look after it?
Yeah, again, I want to mention smoking maybe as the first thing, to try to stop smoking, although it's very difficult. Help with smoking cessation is available for free. And it's there on the NHS and elsewhere. Someone can walk into the pharmacist and ask for assistance. So any reduction in smoking is a fantastic thing for lung health. Secondly, the lungs are like sponges. So, staying hydrated is another thing that people might perhaps forget about when they're sort of out and about or, wanting to keep active. Good to keep drinking well. Beyond improving diet, I suppose cutting down on exposure to pollutants, taking walks in green spaces, making sure places where we live and work are well ventilated, avoiding the development of mold or, keeping sort of moisture down, let's say in a home setting would be a good idea. And I suppose finally, a simple thing, take care of other conditions that can affect the lungs like asthma. Keep in touch with the GP.
It's really interesting what you mentioned there, because when we think about air pollution, we tend to think about outdoor air pollution, but of course we spend a lot of our time indoors as well. So the quality of the air in our homes and in our workplaces is also important. And we can all think about things we can contribute, I think, to reducing air pollution. We know that a lot of people jump in their cars to do very short journeys, even journeys that are less than 1 mile, when if we all tried to walk more or cycle more and not use our vehicles so much, then that would help all of us.
That's right. And keeping the home well ventilated, opening the windows in the morning when one can, obviously, in the cold part of the year might be a bit counterintuitive to do that, but it does refresh the air. And you're right, just walking when one can instead of taking the car is great, not just for the person, let's say, who happens to sit in a car in a polluted space themselves. It's not, shall we say, the healthiest place to be, but yeah, getting out and about, as you say, Zoe, very healthy.
And also there are some more fun ways in which we can help take care of our lungs as well, aren't there? Some more quirky ways like mindful breathing or even laughing. Can you tell us a bit about those?
Yeah, I mean, the diaphragm is the muscle that's underneath the lungs, and by pulling down, it allows the air into the lungs. So, diaphragmatic breathing, as people might have learned when they, let's say, have had singing lessons or they are a member of a choir, then that's really great for lung health, opening up those lungs in all parts. Laughing, you're right. I mean, even somewhat forced laugh or just a natural laugh can help, keep the blood flowing, the oxygen moving in and out of the body. And I suppose one thing I'd like to add as well is around posture. So sitting up straight like you're doing now is good, so that way you can increase the lung intake of air and make sure that everything's working well.
I once got an opportunity to go to a yoga laughter class. And it was this amazing class because, I mean, you ran around a lot, so it was good exercise, but most of the exercises involved laughing, and often that was forced laughter. It wasn't genuine laughter, but actually your lungs get the benefit and you also get the mental health benefits of laughing, even if it's fake. So if you force a laugh, your brain can't tell the difference. You still get that release of those happy chemicals in the brain. So yeah, laughter is the best medicine, as some would say. You mentioned exercise. Now, obviously that's so important for our health and especially for our lungs. Does it need to be high intensity exercise? Does it need to be running? Do we need to be getting really breathless? Or are all types of exercise good for our lungs?
Yeah, I mean, high intensity exercise suits some people. It also suits some people maybe at some stages of their lives. But I would say that, an amount of exercise at all stages of life is great, really. National guidance would say to aim for 2.5 hours, that's 150 minutes in total in the week, getting the heart rate up and therefore also getting the breathing rate up as well and bringing plenty of nice oxygen air down into the lungs. I'm a big fan of swimming, Zoe. So, there, diving into the water, having to hold one's breath, moving the body, circling the arms in various sort of types of swimming stroke. It's a great activity. It's non-impact. It's very soft on the joints and the muscles. It also has the great benefit, swimming does, of being a lifelong activity. So it's probably a top tip for lung health.
And I would say it sounds like you really enjoy swimming. And I think my advice often when people are trying to find what works for them is it's got to be something you enjoy and something that's accessible. Because the most important thing is that you do it regularly and you keep it up. And if you love it, you're more likely to do that. Well, thank you so much, John. That was a really interesting chat. And I think we've got some great tips there, things that we can all do to help look after our lungs.